Yeah, so I think it just kind of depends on the injury. So if it's a very acute injury, they got kneed in the quad, it's a quad contusion, I think you can treat that pretty specifically and get them to return to play without addressing kind of their full body needs as far as they would present on an SFMA. But the injuries where, even an ankle sprain, even though that's acute, just like the contusion, it can have some changes in the biomechanics of the person. And so using the SFMA to look at their whole body, the whole system of movement, you can address some things. And I think it's getting used to the SFMA and determining what things we really need to fix to get this person to the highest level of performance. So, for example, one of the tests just looks at cervical flexion. So in this day and age, when people are on their laptops, on their phone, just we're such a forward positioned society with the things that we do. Most people lack that cervical flexion. And so is that something I'm going to get hung up on to limit their return to play? Probably not. But for a soccer player, for example, if they cannot get the proper dorsiflexion that we know is optimal for somebody's performance, then that's something I am going to address. So I think using the SFMA to look at how they're moving and then deciding based on their dysfunctions or based on what they present with, what are the things that we really need to fix to get them to return to play safely. And it's always a tricky question because in athletics, time is always of the essence. And so, you might not be able to fix the things the way that you want to in the middle of a season. So I think determining the time of the season, how much time you have, how much time you can kind of remove them for their sport to address some things as to how you make your decisions on what to fix and kind of prioritizing what you want to address.